Well, the National Primary Healthcare Development Agency says there is no truth to some media reports that Nigeria has been placed on a red list by the United Kingdom because its COVID-19 certificate is not recognized. Well, Arise News correspondent Chinaza Samuel has this report for us.
The United Kingdom relaxed COVID-19 restriction for 50 countries excluding Nigeria and other African countries. This means Nigerians entering the United Kingdom will be subjected to COVID-19 test and isolation in spite of the COVID-19 vaccine certificate obtained in Nigeria. There have been reactions to this, with some people saying the development means the UK did not recognize the COVID-19 vaccine administered in Nigeria.
Nigerians will continue to isolate.
But at this media briefing, the National Primary Healthcare Development Agency explains the situation.
Nigeria's status has not changed. Nigeria is not among the red-listed countries that need to mandatorily quarantine for 14 days in a supervised UK facility. The statement released by the UK government is consistent with the press statement released last week that Nigerians will continue to isolate upon arrival to the United Kingdom. This is similar to our requirement that travelers from the UK should isolate for 7 days when they arrive Nigeria.
There is also good news for the country, as the agency also announced that the country has taken delivery of more vaccine. It is also expecting more in the coming weeks.
Yesterday evening, we received a consignment of 501,600 doses of the AstraZeneca vaccine from the COVAX facility as donation from the government of France. We have also gotten confirmation that we will be receiving 3,577,860 doses of Pfizer vaccines within the next 2 weeks.
The World Health Organization and the United Nations International Children's Emergency Fund present at the briefing are commending Nigeria for the strategy it adopted in administering the vaccine and recommended same for other African countries.
Nigeria has provided guidance to other countries on how to roll out an effective response to an emerging disease such as COVID-19. Nigeria is also providing an example on how to effectively roll out the COVID-19 vaccination in a complex situation. And from WHO perspective, we look forward to Nigeria sharing its example and the experience in how to roll out the COVID-19 vaccine to inform other countries.
The number of people that are being vaccinated daily in Nigeria against COVID has increased. And this is commendable, thanks to the leadership and to the hard work of yourself, Your Excellency, and those who are at the forefront of this work.
Dr. Faisal Shaib advises Nigerians who have taken the first jab of the COVID-19 vaccine to take the second, which is the guarantee of complete vaccination. Chinaza Samuel, Arise News.
Right, for more on this and other issues in the health sector, we're joined by Dr. Godiya Ishaya, the President of the National Association of Resident Doctors. Glad to have you join us on Newsnight, Dr. Godiya.
Thank you.
Well, okay, fine. Let's just get to the brass tacks. You suspended, but not totally called off your strike. After this expiration of 6 months, what happens next?
Well, after the expiration of the 6 months, we will convoke an emergency National Executive Council meeting where the National Executive Council members will have to review the situation that it will be at that time, and then this appropriate decision will be taken.
Right. So I do know that you're still meeting, even just last night. I know you had a meeting with the Minister of Labour. What are still the sticking points, the outstanding issues that are yet to be resolved?
The issues that are still under contention are the issue of the debt in service benefit to the next of kin of our deceased colleague, which have not been fully resolved, and the issues of payment of the residency training areas and domestication of the medical residency training laws in the various states government. However, we appreciate the effort made so far by the Delta state government in implementing it and commencing the payment of the medical residency training allowance to our members in those states, and also the effort being made by the Benue state government in implementing or domesticating the law in the state. So there are other issues also that are still pending, issues that had to do with the salary areas of our members for 2014, 2015 and 2016. But I must say that I commend the effort of the Honorable Minister for Labor and Employment. He has shown that he is a very good conciliator, and he has actually arbitrated very well in these matters that led to the suspension of the strike.
That's indeed interesting to hear. Well, we learned that government met most of the conditions for suspending your strike. So what percentage, let me put it like that, is remaining, you know?
Well, I can say about 60% of the demands the demands that force us to embark on the strike are still unresolved. However, there is a genuine effort toward resolving those issues, and
so
because
only 40%.
of that, yes, and because of the genuine effort that we have seen from the government side, that was what made us to convoke an emergency National Executive Council meeting that led to the suspension of the strike.
Right, and I do know that some of your demands that you've actually laid out is that the government should also withdraw that industrial action that it did file against the resident doctors. Have they heeded to that demand?
Well, actually, before we even suspended the strike, there was a memorandum of understanding that was signed between the Nigerian Medical Association. Our association could not append or could not complete that memorandum of action because of some items that were there. However, the Nigerian Medical Association, which is the umbrella body which we all belong to as well, appended their signature to it, and in that memorandum of understanding it was agreed that as soon as we call off the strike, the federal government will withdraw the case from court to allow for negotiation, or to return back to the negotiating table with the government in order to resolve the other issues that were still pending.
Has that been done?
Right.
That's the question. You still didn't answer.
We have a meeting tomorrow scheduled with the Honorable Minister for Labor and Employment by 2, and we hope to resolve that and take the case out of court and resolve it on the negotiating table.
All right, the NAS and some other bodies intervened for this industrial action to be called off. How do we make sure that with the FGN, that is federal government, all these bodies that intervened, FGN state, that strike becomes a thing of the past for the resident doctors and for patients as well?
Well, we actually are hopeful also that strike will be a thing of the past, especially with the intervention of the president of the country, who actually called on us to return back to work and promises that he was ready to resolve all pending issues with us. We believe and also trust that he is going to carry through with those promises. And also there are these issues have been in the front burner for some time, and Nigerian populace and masses have also and also the media are well aware of those issues which have been perennial. With this commitment from the government, the highest echelon of the government, we believe that those issues will be resolved as have been promised.
Right. As we get ready to wrap up this conversation, let's first of all say congratulations to you. You just became president of the association during the times where your association was on strike. But really, what fresh perspective are you bringing to the management of this crisis? And like Indy says, to avoid a future occurrence and the brain drain that we're seeing of the doctors, you know, going for greener pastures elsewhere.
Well, thank you very much. Just as you said, we were elected on the 15th, rather inaugurated on the 25th of September, and we are barely, I could say, 9 or 10 days today. When we came in, we realized that a lot of the discussion have been stalled, and there are a lot of hindrance on the way, and we came in, we felt there's a need to meet with these government officials who are stakeholders in resolving these issues. And since then, we have been meeting with one government officials or the other in order to see that these issues are resolved. Largely, I can tell you that what we have been clamoring for is still at the stage of the essential things that the government need to have done, but that haven't been done yet. We still have the issue of infrastructure and workplace environment to fight for, but we have been stuck on issue as basic as emoluments first, which we felt we needed it first before we start talking about those. But we are hopeful with the enthusiasm or the zeal and commitment of the Honorable Minister for Labor and Employment and the Mr. President of this country, that those issues will actually be treated with the urgency that they are required to avert further exodus of expertise of our best brain to other countries. Yes.
All right, Dr. Godiya Ishaya, President, National Association of Resident Doctors, will leave you there. Thank you for being here.
Thank you for being here.